Hi, I'm Dr. Annette Mercatante, the Medical Health Officer at the St. Clair County Health Department. So here we are, staring down the barrel of COVID again. It's been difficult for all of us. No one's really escaped the burden of trying to make choices that impact our health and the health of our loved ones. You know, the vast amount of uncertainty, misinformation, all the real-time adjustments we've had to make as new guidance comes out, it's all made us weary and confused. So counting bodies has not been easy for us either. We're here with you in the trenches, experiencing all the same things you are. But it's very clear that our single fight in this whole thing is the virus. We are fighting against the disease itself and trying to reduce the impact of this next outbreak. So it's important to remember that long-term complications of COVID, not just hospitalizations and death, all are significant reasons why we want to reduce the impact of this infection on other people. Especially even young people can have long-term complications and hospitalizations. And the most important thing is that this is preventable now. We know this is preventable between the vaccines and our actions, particularly masks and distancing. So we have to use these tools to try and control the problem. And we agree that children in particular and our schools need to be back in school as well. We want to reduce the impact of this disease on everyone. So kids need to be in school. And how do we actually do that, knowing how infectious this virus is? One thing is very clear. If widespread and uncontrolled COVID infections occur, then in-class learning will be disrupted. Individuals who are infected will have to remain out of class and out of any social situation for 10 days following the onset of their symptoms. That's called isolation. So if you're ill with COVID, you need to remain home for 10 days. Those who are exposed to people who are ill and have no symptoms have no way of knowing whether or not they're infected or not. Remember, this infection can take up to 14 days to fully become infectious in your body, and you can spread the virus a couple days before you even get sick. So when you've been exposed and are not ill, we ask you to separate yourself from other individuals so that you don't become infectious and contaminate other people. We call that quarantine. So quarantine is going to be based in the school year based on what strategies are in place to reduce the transmission. We know that if all the strategies are in place, that transmission is very low and quarantine could possibly be markedly reduced or even eliminated. However, if there are no protections in place, no masks, no distancing, no vaccine, that the risk of getting infected after exposure is much higher. Remember, the Delta variant is even more contagious than the one that was circulating in the spring. So what does that mean? That means that every person within 6 feet of an infected individual for at least 15 minutes, and that individual that's exposed is not vaccinated and they're not wearing masks, that individual will have to stay home and not interact with people outside of their family for 10 days. We're going to use a 10-day quarantine, but that can be adjusted up to 14 days depending on what the situation is. If there is consistent layers of protection in place during this exposure, i.e. what I'm really talking about here is masking, but also distance, etc., it is possible that the risk of transmission is very low. We can reduce that distance to 3 feet, and we can allow students staying that were within 3 feet to stay, outside of that 3 feet range to stay in the classroom. So again, our quarantine measures, our parameters can vary based on how we feel the risk of that exposure is going. This is consistent with CDC and MDHH's guidelines. We're not just making this up. And it's really in place so that we can keep as many students as possible in the classroom. So is not wearing a mask worth not going to school? Does the avalanche of misinformation and anger make the entire body of evidence that we have supporting these strategies just go away because you're mad? Do you really believe that we, as a health department, and the entire nation of healthcare providers, researchers, scientists are all systematically and nefariously creating this false scenario to hoodwink you? Really? I hope you would answer no to all those questions and understand that everything we're doing, we should be doing together for our collective benefit. Okay? The collective benefit is to fight the virus, reduce the transmission, and control this outbreak. If we do that right, our kids will be able to stay in school, which is a really positive step in the right direction. Thank you very much.